At first, it usually feels like a simple delay. You check the calendar, count backward, and attribute the missing days to recent stress, a heavy workload, or maybe travel. But you wait a few more days, and those days stretch into weeks. You take a pregnancy test. It comes back negative. You take another one, and it is negative too. That series of negative tests shifts the reality of the situation. The assumption of a temporary pause fades, leaving a persistent, quiet question. Where exactly did your body's internal rhythm disappear to? In a clinical setting, an absent cycle is often logged simply as amenorrhea. On a physical level, this absence is your body signaling that a deeper system is out of balance. Brushing that signal aside as a natural reaction to stress overlooks the reality of living with it. Long gaps without menstruation carry physical uncertainty and an emotional weight that require a thoughtful response. The standard medical response to amenorrhea often relies on synthetic hormone therapy. These prescriptions are highly effective at one specific task, inducing a scheduled bleed. But creating an artificial bleed from the outside is biologically distinct from restoring your body's own capacity to cycle naturally. For women who want to preserve their natural menstrual function rather than replace it, a critical question emerges. Is there a way to gently coax the body's natural systems back online instead of overriding them? This is where an alternative philosophy of care enters the picture. It centers on a purely external approach, known as the 5 Essences Herbal pouch. The pouch itself is a flat, stitched rectangle with sealed edges. You wear it discreetly at the navel, held in place by a soft, breathable belt. The defining feature of this therapy is that absolutely nothing is swallowed. The herbs remain in continuous contact with your skin, bypassing the digestive system entirely. By remaining entirely on the outside, the intervention integrates into an ordinary daily routine without adding any physiological burden to your stomach or liver. To understand how an external pouch influences an internal cycle, we can look at this diagram. Traditional Chinese medicine views amenorrhea not as a single uniform condition, but as a disruption rooted in one of 2 primary patterns. The first pattern is blockage, or what TCM refers to as blood stasis. In this state, the biological components for flow are present, but a physical or energetic bottleneck restricts them from moving smoothly. The second pattern is depletion, known as blood deficiency. Here, the body lacks the physical reserves required to build and sustain a menstrual cycle. The herbal pouch is formulated to target these specific interactions. Resting at the navel, it provides continuous support aimed at clearing the restriction in a blocked system or gradually nourishing a depleted one. By addressing the specific root pattern causing the disruption, the therapy works to help your body resume its own natural rhythm. This process requires sustained contact. Each pouch is worn at the navel for continuous stretches of more than 72 hours at a time. That creates a very different daily experience. Instead of managing a rigid schedule of swallowing synthetic hormones, you are relying on an active, routine-friendly external support system. It provides structured, continuous treatment while fully preserving your body's biological autonomy. To see how this TCM theory translates into clinical reality, we can examine this visualization of the Wang 2025 case series. It tracked a cohort of 11 women, aged 34 to 50, all experiencing amenorrhea. Following the external herbal pouch protocol, 9 of the 11 women successfully resumed menstruation within 30 days. The cohort included notable individual cases, such as one woman with elevated menopausal range FSH levels who resumed her cycle, and another who maintained regular cycles for more than 3.5 years after a single course. It is important to contextualize this data. These are documented observational clinical experiences, not the results of a randomized controlled trial. Based on those observations, a 30-day timeline of expected physical shifts emerges. The first 2 weeks act as an activation and building phase, often marked by subtle signals like improved rest and distinct warmth at the navel. Moving into days 15 through 21, users frequently report the quiet return of cyclic awareness, accompanied by the familiar premenstrual cues they used to experience. Finally, during days 22 to 30, the building phase culminated for the majority of the women in the case series with the return of menstruation. The timeline is a guide based on listening to subtle daily life signals from your own body, rather than waiting for a mathematically scheduled effect from a pill. If your period has stopped after birth control, during perimenopause, or following the period of intense stress, you have choices regarding how to respond. This method offers an approach that requires no pills and creates no replacement cycles. It is a strictly external, TCM-framed intervention designed entirely to support your body's innate capacity to heal itself. If this external approach aligns with how you want to care for your body, you can explore herbal pouch therapy further at 5essences.store.